So I think one of the major things with telehealth is there's a lot of motivation to try and integrate it into lots of different areas of health at the moment. And I think the biggest motivator for me working in a hospital in the home team where we help kids be at home while they access their treatment is that I have to physically drive to families' houses to see them. So telehealth was a great opportunity for me to be able to see more patients, access more areas and not have to drive quite so much, which is good because Australia is very big. It is very true.
Very beautiful, by the way.
Yeah, it is pretty great, but also a long way between different places. So yeah, I have been using telehealth to help with my patients who often have respiratory conditions like cystic fibrosis, who generally receive physical therapy sessions twice a day when they're undergoing acute treatments. And so in order for me to be able to see them at home for their sessions twice a day, I've started to use telehealth, which has been a huge improvement in our ability to access our patients, but also an ability for our patients to get more choice around when they want to be seen. Right. When we have just home visits where we physically drive to our patients, often we're restricted by traffic and time and things like that, whereas with telehealth we can see kids before or after school, helping them get to school on time, or being able to access them with their families if their families aren't necessarily in the same place, and all of those kinds of things.
Do you feel that as a result of giving more flexibility and time and routine for your patients that they are actually becoming more compliant?
Definitely, and I definitely think that giving them some of the choices and some of the ability to be able to help formulate our schedule means that they take on some of that responsibility themselves and they feel empowered to be able to access their own healthcare, which is great because when you're sitting in a hospital bed, often it's a very passive kind of treatment in that whenever the person who is the hospital clinician turns up is when you get your treatments.
Right.
Whereas when you're at home and you're choosing to call into telehealth to see your therapist, you've made that conscious decision to be able to access your treatment, and often that means that, especially for my patients who are children, it gives them a bit of like a boost and they feel a bit like they've actually made the choice, whereas it's not just their parents or their health professionals telling them that this is what they have to do right now because that's what's good for them.
Right. And is there an example that you could give that is specific and anecdotal that would represent a positive outcome?
Definitely. So we have a lot of patients who have a very high burden of care with their conditions. So we had a 9-year-old patient recently undergo a double lung transplant for his condition, and he spent 9 months in hospital straight before that happened and during that process. So being able to get him home but still have the support of his clinicians being able to see him doing his therapy at home meant that we could support him a lot better in being out of the hospital system, but also making sure that those new lungs were doing the right thing and being cared for well by this 9-year-old boy and his family so that he can have the best opportunity to continue to use those lungs and grow and be able to go back to school and play football and do all the things that 9-year-old boys like doing.
Yeah, and on some level, I think, when you talk about how to empower a patient to feel better, the whole idea of continual guided care, even on like a psychological level of just kind of being loved, right? Especially for someone as young as that. If I was an older person, or not, just a skeptic in general, and I looked at you and said, look, you can tell me about this telehealth and this video call, and I'm not interested because I don't feel like it's personal.
Yeah.
What's your response to that?
I think that's a very common thing for us, especially with parents. I find that the children themselves, our younger patients, are in this technological generation where video call is so normal to them that they're like, yeah, sure, that's fine. But it's the families often that I find have the anxieties around using telehealth. They often feel like they're not going to get the same amount of care or the same amount of interaction between me and their child by having a telehealth session rather than a face-to-face session.
And has it worked out that way?
Definitely, we've found that I think the big anxiety is around the families having it set up and having that first call, I think is a big thing for them.
Yeah.
But once they see me on the screen and they're so familiar with seeing me in their homes, and they realise that I interact with their child exactly the same way over video call as I do if I was sitting there in their lounge room on their couch, they find that then alleviates a lot of those fears. I think a lot of the time I try and convince the patient that it's going to be a good idea, and then once they're on board, they kind of niggle with their parents until their parents agree, and then once they see the end result, it all works. It's like, and they realise that they just get more access to me. It's an added benefit. It's not instead of something else.
That's right. That's awesome. Well, Chloe, it's been really nice speaking with you. Thank you for joining us.
Well, thank you so much for having me.